Hi, good evening, ministers and DMS. Over the past week, we had around 10 new clusters every day, and most of them are named after individual case numbers instead of a specific location. And this has caused some anxiety and uncertainty among general public. So could the ministers share if having 10 new clusters a day is also part of this new normal living with endemic COVID? And under what circumstances will MOH name a cluster after a location, such as the North Bridge Road Market Cluster, which I believe was previously named after a case number? Thank you.
DMS?
We've always been naming clusters after the index case or case number. That actually has been our practice right from the onset. We had provided some additional information in the past for some of the clusters, in fact, many of the clusters in the past, where it made sense because most of the transmission had taken place within certain locations. But as we evolved in our management of COVID-19 cases, we found that actually the link sometimes is more related to activities rather than necessarily of locations. And the transmission then occurs as a result of that. Taking into account from Jurong Fisheries Port into the markets, we've noticed that this was the case, and therefore it wasn't helpful necessarily then to name clusters on the basis of fixed locations sometimes, because the mode of transmission, what was more important was activities that took place. So we will continue to look at this. We will continue to be naming and referencing clusters based on the index case that is actually mentioned, but where it makes sense from the epidemiological perspective, it helps us with our public health actions, it enhances our ability to gain control of a cluster, to name specific locations, then we will consider doing so. But the base practice still remains to reference these clusters in relation to the index case.
Maybe let me just add a couple of points again to put things in context. Is in an earlier stage when we don't have trace together and we use manual tracing, and then when we announce the clusters and where what are the places the infected persons have gone to, and then people will try to avoid going to those places. But increasingly too, you realize that if the cluster is small, is sporadic, after the people go to a certain mall or certain hawker center, it's transient. And chances of you then going and catching the virus actually is quite small, quite small. I think what we worry about is, let's say in a mall or in a hawker center or market, there are clusters and the virus is still transmitting. And then when you go, then you have a chance of being infected. So what do MOH do now is we may close down the mall or close down the market temporarily. Or people who have come into contact with infected persons, now that we have TT tokens, we can trace them and tell them, please go for a test and isolate yourself until your test result come out. Or you have really come into contact with a exposed person, we may even quarantine you. So now the technology is quite different. And so for our, for your readers and Singaporeans in general, I think rest assured, if you are exposed and our data show that it is so, we will SMS and let you know. And if a place we feel is unsafe because transmission is happening, we will close down the place and we may test the people living around the place. Yeah. So the situation is quite different. But having said that, as I mentioned just now, as we move into the preparatory phase, and if everything goes well, we move to a transition stage A, economy will open up, activities will open up, and we are likely to see higher infections, actually. What's important at that time is to strike the right balance, make sure that hospitals' capacity is not overstretched, then we can keep severe illnesses, ICUs, and even deaths under control. But chances are they will rise, no? If we want to protect livelihoods and open up the economy and social activities, there is an implications in terms of infections, severe illnesses, even deaths. So we must manage this in a delicate balance. Yeah. But we will have to expect cases to increase, more clusters to come up. But focus on where the big clusters are, focus on severe illnesses, focus on ICU cases.